How does secondhand smoke harm people with COPD? Imagine breathing in invisible smoke every time someone lights a cigarette nearby. That's what people with chronic obstructive pulmonary disease face when exposed to secondhand smoke. It's not just a minor irritant. It can cause real harm to their already fragile lungs. When someone with COPD is around secondhand smoke, the damage happens quickly. Even just an hour of exposure can cause a sudden drop in lung function. This happens because the smoke irritates the airways and triggers inflammation in the lungs. For people whose lungs are already damaged, this can make breathing even harder right away. People with COPD often notice their symptoms worsen when exposed to secondhand smoke. Their coughs become more persistent, and wheezing gets worse. Studies show that those who breathe in secondhand smoke are more than twice as likely to have a chronic cough. Wheezing also becomes more frequent, making it harder to breathe comfortably. This extra irritation can lead to more frequent flare-ups or exacerbations, which are sudden worsening of symptoms that often requiring medical help. These flare-ups mean more days of struggling to breathe, more medication, and more trips to the doctor. The overall quality of life drops for COPD patients exposed to secondhand smoke. They report feeling less healthy and more tired. The ongoing irritation and flare-ups take a psychological toll, making everyday activities feel more exhausting. One of the most serious risks is the increased chance of death from COPD. If someone with COPD is exposed to 10 or more hours of secondhand smoke each week, their risk of dying from the disease goes up by more than 40%. This is because the smoke causes inflammation in the lungs, which worsens the damage already caused by COPD. Biologically, secondhand smoke triggers the releases of inflammatory substances in the lungs. These include cytokines like IL-4, IL-5, and IL-6, as well as tumor necrosis factor alpha and interferon gamma. These substances damage lung tissue and make airway obstruction worse. The more someone is exposed, the greater the damage. There is a clear link between the amount of exposure and the level of harm. Even just an extra hour of secondhand smoke each week can increase the risk of COPD problems by about 3%. People who have never smoked or who used to smoke are especially vulnerable. Their lungs are already compromised by COPD, so additional exposure to secondhand smoke can cause more damage. Children who grow up around smokers are also at risk. Long-term exposure during childhood increases the chance of dying from COPD later in life by nearly a third. This shows how early damage to developing lungs can make someone more susceptible to serious lung diseases as they get older. The good news is that avoiding secondhand smoke can make a big difference. Experts recommend staying away from environments where smoke is present. There is no safe level of secondhand smoke exposure, so complete avoidance is best. If someone lives with a smoker, encouraging them to quit is a vital step to protect everyone's health. Protecting people with COPD from secondhand smoke is essential for managing their symptoms, improving their quality of life, and reducing the risk of death.